Hello everyone, this is Dikshak Bhatt from Team OYG. On behalf of our team, I welcome you again on this another interesting session. Today we have a topic of a sports nutrition, and to guide us on this particular topic, we have a wonderful speaker all the way from Canada, Michelle Malik. Michelle has successfully completed her undergraduate bachelorate science degree in 2018 in the University of the Waterloo with honors of biology major and a double minor in the fields of human nutrition and psychology. She is very passionate about her academics and fascinated by the many fields of science, but particularly the field of biochemistry. Michelle additionally has an interest in healthcare. She believes in the theory that one must target the root cause of a sickness and disease rather than treat by the symptoms. So, for this belief, Michelle has decided to continue her education in the discipline in naturopathic medicine at the Canadian College of Naturopathic Medicine in Toronto, Canada. Michelle has particular interest in sports nutrition, rehabilitation, and weight management. Her most recent research projects have been dedicated to the congenitive rehabilitation following a mid-traumatic brain injury. I hope, Michelle, I haven't missed anything from your introduction. And even if I miss, you can continue with it. And now, without a further ado, I would like you to take over.
Thank you for the introduction. So I will. Okay, so let's get started with naturopathic medicine. So this is my introduction, which we already went through. Here's also a picture. So and this is what people to the profession. So the main one of doing no harm, which is the Hippocratic Oath, essentially. Then we also have the healing power of nature, identifying and treating the root cause of disease, treating the whole person through individualized treatment, the doctor as a teacher, and emphasizing prevention, which are all really key in helping sports nutrition and any sort of Medicare through naturopathic medicine. And another thing that we do in North America, specifically with naturopathic medicine, is going through the therapeutic order. So we'll obviously start at the bottom of this triangle, which is establishing the foundation for optimal health. And then we'll move up if there's still things to progress through the sickness. So stimulating self-healing mechanisms, and then we're going to support and restore weakened systems. And then we'll address the physical alignment. And then we're going to move into natural symptom control. So that's more of our natural substances that we're going to use, some nutritional interventions, as well as any other of our modalities, which we'll get into next. And then we'll go into synthetic symptom relief, which is a lot of our pharmaceutical treatments. And then we move into high force interventions, which is more of surgical treatments. So our 7 modalities that we use in North America for naturopathic modalities are hydrotherapy, nutrition and supplementation, which we'll talk a lot about today, botanical medicine, which is a huge interest of mine. I love botanical medicine, and traditional Chinese medicine, physical medicine, homeopathic medicine, and health psychology. So when we do naturopathic treatments, we can use 1, 2, 3, or all of these modalities to help any nutritional protocol or health protocol. But what I really want to talk about today with you all is concussion. So we're going to talk about what is a concussion, how to identify that someone has a concussion, and how naturopathic medicine can help. And this is a really big topic within sports medicine. I don't think I've met a single athlete who hasn't experienced a concussion or who hasn't been told how to prevent concussion from happening. It's a really big topic in the sports world of medicine. So we'll just start with what a concussion is. So it's caused by a force, often to the head. It results in the head and the brain moving rapidly back and forth. The movement that happens or occurs causes damage to brain cells, which results in a change in the shape of the brain. So there's chemical and metabolic changes that occur within the brain cells, and it ultimately makes it more difficult for the brain cells to function and communicate. So concussion can also occur by a hit somewhere else in the body, secondarily to getting transmitted to the head. Often secondary concussions occur with weak neck muscles. So a lot of our protocols will strengthen the neck muscles, so that way that helps and to prevent the concussion from occurring. And it'll most often occur in infants for secondary concussion. Primary concussion, so with a hit to the head, that most commonly happens in high school or collegiate athletes. So a lot of varsity level athletes are experiencing concussion more commonly. and females tend to report the most severe symptoms. So we'll move into the pathophysiology of concussion. So the pathophysiology of concussion involves functional or microstructural injury to the brain. A neurometabolic cascade of events has been described in both animal and human studies. There's a potassium efflux from the neurons that occurs after the biomechanical injury. So after the hit to the head, there's this potassium efflux that occurs. Following this potassium efflux, a dramatic increase in excitatory and extracellular glutamate gets pushed into these brain cells. The glutamate activates N-methyl D-aspartate, the receptor, and this leads to neuronal depolarization and further potassium efflux and sodium influx. So this cascade of events depresses neuronal activity. It increases the use of adenosine triphosphate, ATP, and hyperglycolysis, which results in upregulation of sodium-potassium ion pumps, depleting intracellular energy reserves in an attempt to restore homeostasis. So I guess like to sum, that's a lot of big words. Basically, when you get hit in the head, there's a neurocascade of events through the transmitters, which is pushing the brain out of homeostasis. So in order to combat that, the brain is trying to use all of its energy reserves to come back into the brain to get it to function properly. Because if you think about it, like when you get pushed over, you're going to want to like push yourself back to sit straight up. And that's essentially what the brain is doing after it's been hit by a concussion or secondary force. After this happens, so there's cerebral blood flow in combination with the increased energy demand that is happening to the brain. And this is kind of pushing the brain into an energy crisis. So now like alarms are going off, like it has no energy reserves, like it's using all its ATP to bring neuronal functioning back into the brain. So neurons are going to bring calcium into the mitochondria. This is all happening in the brain cells in an attempt to balance the increased intracellular calcium. This leads to mitochondrial dysfunction and impaired oxidative metabolism, which worsens the energy crisis. Rapidly progressing hypermetabolic state results, and this may persist for up to 4 weeks after the increase in glucose metabolism within the brain. The intracellular calcium influx can cause structural damage to the cytoskeleton and injure the axons, primarily from shear and tensile forces of trauma. The structural damage reduces conductive velocity through the neuron and is thought to be correlated with cognitive impairment seen. Little cell death is actually seen in concussion, and it's still unclear how chronic structural brain changes and cognitive impairment can occur over time. But this is just a proposed mechanism that has been seen. So then looking at the symptoms of concussion, so after all this process has happened, like what are we actually seeing in our patients? So there's a wide range of symptoms that exist, such as memory problems, irritability, confusion, fatigue, dizziness, double or blurred vision, seizures, headache, nausea or vomiting, sensitivity to light or noise, balance problems, slowed stimulation, and slowed reaction to stimuli. So these symptoms aren't life-threatening, but they can change the daily activities of the individual that experiences a concussion. It's important to note too that the symptoms of concussion exist on a continuum, and patients experience a wide range of symptoms in various degrees. So they might experience one of these symptoms, two of these symptoms, or like all of the symptoms, and the symptoms can be different for each individual. And because of this, it's really hard to put into definition the diagnosis of a concussion without knowing that they've been hit in the head, because realistically, like all these things could happen in other conditions as well. And because of the varying degrees and the difference of symptoms, you can't really define a concussion for every single person. So then why talk about concussion? Like, why is it so serious? It's actually due to the prolonged effects of concussion and what happens after. So repeated concussion ultimately results in more serious conditions of neurodegenerative diseases and mortality. So individuals who have a history of concussion are 2.5 times more likely to experience early onset of dementia and or Alzheimer's disease. And these are memory problems within the brain, which really impact your life, being unable to remember family members, close friends, like your own self, which is really debilitating. So one theory to explain the increase in likelihood of these diseases is that there's an increase in acceleration of accumulation of abnormal proteins leading to neuronal cell death associated with dementia and Alzheimer's disease. And then also noting that repetitive concussion is also a major contributor to mortality currently worldwide. So it's really important to look at concussion and how to treat it, because it's a common injury that occurs. And of course, these are really serious diseases that, of course, we want to prevent. And so we'll look at how to prevent them next. So how can naturopathic medicine help? The following treatments I'm going to look at today are research treatments for concussion, and they don't encompass the totality of treatment, but they're just the ones that I've personally looked at, and I've personally seen valid research for them, as well as looked at different studies, and have seen different observational reports as well within patient populations. So there are supplementations of vitamin D, vitamin E, omega-3, specifically DHA, nicotinamide, sulforaphane, zinc, resveratrol, and then looking at botanical medicine of Panax ginseng, which is also known as Asian ginseng, and curcuma longa, which is found in turmeric. And then there's also physical medicine that we can do, such as cervical manipulation. So that's a lot of chiropractic movement of the neck joints, sorry, and also exercise. So let's look at these in specific detail now. So we're going to move on to vitamins D and E specifically. So vitamin D, one thing to note that I don't actually have on the slide is that you always want to take vitamin D levels within your patient population before prescribing over 1,000 IU per day, because vitamin D have a toxicity level that we want to keep in mind. Although lower levels of vitamin D are present in the individuals post-concussion, you still want to check their levels to make sure that we're not giving them a toxic dose of vitamin D. Vitamin D deficiency also displays worsened outcome following concussion. So it's really important to check their levels, making sure that they are at optimal levels. So that way their symptoms aren't getting worse just due to that lack of vitamin D. In animal studies specifically, the combination of 1 microgram per kilogram of vitamin D with 16 milligrams per kilogram of progesterone reduced markers of inflammation and neuronal cell death, which is pretty cool. That combination is actually a pretty great outcome. And then looking at vitamin E. Vitamin E at 2 IU per gram improved cognition following repetitive concussions. It also reduced oxidative stress, and it showed improvements in learning and memory. So that's pretty cool. And that again was only seen within animal models. There was no human models for these supplements to look at. Looking at nicotinamide, which is also known as vitamin B3, and sulforaphane. So nicotinamide, the continual injection of 150 milligrams per kilogram per day had shown optimal neuroprotection following a concussion, and it should also be given with progesterone, similarly with vitamin D. And sulforaphane improved the integrity of the blood-brain barrier. It also reduced the cerebral edema seen following a concussion, and it could also improve cognition. Again, these were also seen within animal models, and there's no human model studies to look at for those supplements as well. And then moving on to zinc and resveratrol. Zinc specifically, so the high levels introduced into the brain provides a protection of the brain tissue and reduces neuropsychiatric symptoms. It also reduced oxidative stress, inflammation, and cell apoptosis. Reduction in symptoms of anxiety, stress, and depression were also seen following zinc supplementation. Resveratrol reduces the oxidative or reactive oxygen species, so ROS, and inflammation. It prevented NADPH oxidative stress, suppressed excitotoxicity within the cells, so that like energy crisis that we were talking about earlier, suppressed that, and it may improve behavior. Again, animal studies, so no human studies were found for these supplements. Looking at omega-3, specifically DHA. So in general, omega-3 fatty acids, so DHA and APA, they're critical components of cell membranes, and they play an important role in optimal brain development. They both regulate the inflammation of neurons by decreasing the production of arachidonic acid. DHA and its derivative metabolites prevent the secretion of pro-inflammatory cytokines and are the substrates for anti-inflammatory docosanoids production. That's again that inflammation pathway. Together, DHA and EPA inhibit the inflammation process. Specifically, DHA is required for brain function. So this is why we really want to talk about DHA, because this one's more specific for the brain. DHA plays a role in memory and spatial orientation. It is found abundantly within the hippocampus of the brain. DHA also plays an important role in neuronal functioning, maintaining the integrity of cell membranes, attenuation of amyloid beta, and reducing the inflammation and oxidative stress. Literature to incorporate DHA into the central nervous system looks promising to improve cognitive function in individuals with mild cognitive decline. Incorporation of omega-3 supplementation with high DHA concentration may be important for memory and cognitive improvement, as it has shown to increase membrane fluidity in neurons and improve neurotransmission. One important thing to note is that there's no randomized control trials available in literature to assess the effect of omega-3 supplementation specific to individuals who have experienced a concussion. But the studies that did look at omega-3 were on individuals who had dementia, Alzheimer's, or mild cognitive decline. The most promising results were seen in elderly individuals who had currently mild cognitive decline. The ones with dementia and Alzheimer's did see significant results, but they weren't as high as the people who had mild cognitive decline. So there's more research that still could be done, but it does look promising, and exact dosage of omega-3 still needs to be evaluated, as well as evaluated the ratio of DHA to EPA still needs to be done, because there's no definitive answer to what the ratio should be, as there are for other conditions with omega-3 fatty acids. So then moving on to our botanical medicines. So our curcuma longa and Panax ginseng. These are really great anti-inflammatory botanicals. So curcuma longa specifically normalized brain-derived neurotropic levels and improved motor and learning performance. And Panax ginseng has the active component saponins, which were as anti-inflammatories to decrease inflammation. With Panax ginseng, they found that 200 milligrams per kilograms for 15 days post-injury has been shown to improve cognition. It also showed protective effects against fatal ischemic damage in neuronal cells, cell proliferation, and enhanced newborn cell survival rates. There's a lot more research done on Panax ginseng than curcuma longa, specifically in humans as well, for following a concussion. The proposed reason for neuronal protection within both of these herbs is due to ursolic acid, present in both ginseng and curcumin. Ursolic acid aids to decrease oxidative stress and cytokines promoting inflammation. So it's seen like a arachidonic pathway that we looked at with DHA is also seen with these two herbs. And then cervical manipulation. So moving into our physical medicines now. So the proprioceptive, visual, and vestibular are key components of cognition. These systems have tracts that run in our cervical spine. So that's why they think that cervical manipulation could be a great component to treatment for following a concussion. The two most common symptoms of concussion are headache and dizziness, which can be attributed to the disruption of one or more of these systems during the traumatic impact. This is why we also think that strengthening neck muscles could also help, because these proprioceptive, visual, and vestibular systems are all running within the neck. So if you strengthen those muscles, you're less prone to getting injury of these tracts within the cervical spine. Additionally, the dysfunction of the proprioceptive, visual, and vestibular systems can persist and increase the risk of future concussion. Through proper cervical manipulation, the proprioceptive, visual, and vestibular systems can realign and reduce symptoms attributed to the dysfunction. Cervical manipulation has also been proven effective for patients who experience neck pain and or functional neck disorders with suspected cervicogenic dizziness, and improve eye-hand coordination, standing static balance, overall balance, and ambulation. It shows a significant decrease in certain symptoms of concussion, such as headache, balance problems, sensitivity to noise, difficulty concentrating, fatigue, low energy, feeling like in a fog, and just overall symptoms of a concussion. It also provides quicker recovery in individuals with persistent neck pain, dizziness, and or headache. So the main symptom of concussion that are seen, it can show great improvement. It was determined that 10 consecutive sessions of treatment showed that individuals could receive significant improvements in cognition, memory, and quality of life. To date, there's only one randomized controlled trial which examines the role of cervical manipulation on patients following concussion, and there's no systemic reviews. These results are promising. However, trials with larger sample sizes and a broader range are needed to validate the results, but they do look promising, and considering that the most prominent symptoms were reduced, this is a great way to treat concussion. And then moving on to our exercise. So this is the most reliable and valid research treatment for concussion. Specifically with sports injuries, it's great that exercise can actually help it, considering most of our sports injuries are coming from athletes, and they definitely do want to get back into their sport, and they're used to exercising daily, so this is something that's really great to see. Physical activity has been proven effective method for maintaining cognitive function and brain health, and it showed to reduce symptoms of persistent post-concussion symptoms. Exercise also improves mental and cognitive activity, which may strengthen thinking and memory. Literature suggests that light aerobic exercise following concussion may provide enhancement of physical, psychological, and academic outcomes and promote recovery. Exercise following a concussion improves cerebral blood flow, oxygenation, brain metabolism, cerebrovascular function, and neuroplasticity. There is recent data to suggest that exercise can enhance brain neuroplasticity as early as 6 to 8 weeks. Improvements in fMRI, cortical connectivity and activation association with higher levels of brain-derived neurotrophic factor involved in neuron repair after injury, increase in hippocampal volume, and improvements in spatial memory is all attributed to aerobic exercise following concussion. So these pathophysiological findings are the purpose for introducing exercise after recovery from the most severe symptoms of injury. So by removing individuals from their daily activities, kind of creates states of anxiety and depression, which can further perpetuate persistent post-concussion syndrome, which obviously we don't want. So it's kind of great that we want to get these athletes back into their normal activities. By decreasing the number of days off work, as well as the number of days that they're away from their daily activities and from their sport, that can actually reduce the anxiety and depression. So we want to decrease those number of days that they're away from their daily normal living. Exercise additionally reduces symptoms of concussion by improving the behavior of the individual, by making them feel less lonely or sad. Usually exercise can be done within group settings, so it promotes that communication and community within people. Exercise for treatment of cognitive symptoms following a concussion show the most reliable results compared to any other intervention that we've already talked about. Systemic reviews and multiple randomized controlled trials were found using exercise to improve cognition, specifically within individuals with concussion. So a lot of the other treatments that we did talk about were more in animal models, or were done on patients that didn't necessarily have a concussion, more so they had a different cognitive impairment. So with the DHA, like they were elder individuals who may or may not have had a concussion in their life, but they did have mild cognitive impairment, or they had dementia or Alzheimer's. And then a lot of the other things that we did look at were done on animal models, except for the cervical manipulation, which just doesn't really have a lot of reliable studies so far done on it. There was very few, but the ones that did look at it did look reliable. So exercise does show the most reliability just based on the number of research articles and the number of studies performed for this treatment protocol. So many trials that were looked at, 20 minutes light aerobic exercise was used. And then this method of treatment is actually already present in the Center of Disease Control guidelines and documents. However, what isn't present in their guidance document is the education about the effects of exercise for concussion treatment. And this really needs to be added, I think, definitely when you start a sport, or just getting into that treatment phase. Just that education of like, okay, like what's happening within the brain, like why did this occur, or what a concussion is, how to prevent it, just really needs to be there before we get to the treatment. I think prevention is definitely a key component for concussion recovery and prevention. So then, according to the results of literature found for light aerobic exercise, it should be implemented within 7 days post-injury when the major debilitating symptoms of headache, neck pain, and dizziness have subsided. So as long as the patient doesn't have headache, pain, or dizziness, exercise protocols can be done. And just a reminder, it needs to be light aerobic activities, so things like yoga, going for a walk, like light swimming, like not aggressive. So they can't go back to their actual sport, but they can do light aerobic activities for 20 minutes per day. So this is just a review slide of everything that we'll cover today. So the supplements of vitamin D, vitamin E, omega-3, specifically DHA, nicotinamide, which is vitamin B3, sulforaphane, zinc, resveratrol, and then our botanical medicines of Spanish ginseng and curcuma longa, and physical medicines of cervical manipulation and exercise. And again, there's obviously more treatments available for concussion. These are the ones I've looked at, researched, and just seen the best results in. So this is why I chose these ones specifically. And of course, there's also more herbs or botanical medicines, that could be used that are also anti-inflammatory, but these ones just showed the best results. And that kind of concludes my presentation today. So thank you for listening. There's my contact information as well if you have any other questions, or if you have questions now. Yeah.
Well, it was a really a great presentation, and I really enjoyed the presentation entirely, and you explained very well. So thank you so much for firstly. And now, I wanted to ask you about yourself first, because I have several questions about yourself. That how did you gain your interest in the naturopathy? That's I wanted to know today.
Yeah, okay. So natural medicine specifically, I actually started my interest in the field of medicine with pharmacy, like pharmacology. Through high school, I really enjoyed my time with chemistry and looking at different ways that chemicals react within the body. So I thought that I was definitely going to go into pharmacy, which is why I originally went to Waterloo, because I thought I was going to go into pharmacy. And one of the only 2 schools to go to pharmacy in Canada is at the University of Waterloo. So I was like, okay, this is what I'm going to do. And then through my own health concerns, I realized that pharmaceuticals didn't actually benefit me. And I actually saw worsening symptoms that were actually worse than the condition I was taking the pharmaceuticals for happening. And so I needed a way to help my own health that was different than the pharmaceuticals, because clearly that was not beneficial to me. So I went and was referred to a naturopath who looked at my diet and looked at different ways to incorporate supplementation and lifestyle interventions. And that actually helped my symptoms a lot better. And I just saw better results and longer lasting results than switching up my pharmaceuticals every few years. And so that was sort of my way that I switched into naturopathic medicine. And I find it pretty similar with my colleagues as well. They have a similar experience of they had a health issue, and naturopathic medicine to be the only thing that really stuck with them and was able to help them for a long term.
Yeah, actually, that was really really great spark that your naturopathy medicine connected you with yourself. So that is what the naturopathy. I believe that spark was really nice you had. One thing I wanted to ask, that in your slide you also mentioned that there are several treatments in naturopathy medicine, right? So among them, which one is your favorite?
I really like traditional Chinese medicine as well as botanical medicine. I also think they kind of overlap a lot. There's a lot of traditional Chinese herbs, which are really great. And along with the botanical medicines that we do learn, a lot of them have warming and cooling effects, which also play a role in traditional Chinese medicine with whether you're more yang or yin, and how to really incorporate that within the body. I also kind of like how traditional Chinese medicine takes you on a very different journey. So they really assess you in the moment, in the present, as well as past traumas and where you're headed in the future. So it takes a lot more encompassing the whole individual, which I really, really like. Because I do like the holistic approach of medicine. I'd rather treat the individual rather than treat their symptoms, which you definitely mentioned during my intro. Because I really think that the mental status of someone affects their health so much. And just thinking that you're going to get better just pushes you in the right direction of actually getting better. Just having that hope and desire to be your best self.
I think you can do that because right now the way you presented the entire session, I think you will be a great doctor. So that's not even doubt. One question is that as that we are discussing about the nutrition today. So what nutrition or what diet you follow right now?
I'm currently a vegetarian, so I'll still have eggs, and I actually can't have dairy because I'm lactose intolerant, which means that my intestines don't tolerate the lactose, which comes with dairy. So I have a lot of dairy alternatives. Um, but if I wasn't lactose intolerant, I would definitely have dairy. I do really like my dairy stuff. Being vegetarian was really more of a ethical thing rather than a nutritional thing. I'm more of like a animal rights activist sort of person, so that's kind of my primary reason for being vegetarian, more so than health reasons. But there are great health outcomes of being vegetarian. Like it's great for your heart health. It's good to reduce like the sodium within your body and like the cholesterol reduction as well. So there are great health benefits. The one thing that I kind of take into consideration, so in North America specifically, a lot of the vegetarian sources of protein don't have all of the amino acids like required, like the essential ones. So I often have to get like vegan protein powders to use, or just a different combination of a lot of different vegetarian protein sources, just so that way I do get all my nutrients. So that's really important to look at as well. So yeah, that's the diet I follow, a vegetarian like diet, but I still also eat eggs because I
No,
need
but
that.
still, it's a kind of healthy diet you follow. So we should take a
Yeah.
tips from it. So that's why because even myself, I don't consider myself as a healthy dieter. So I would follow that tips from you. Can you share your any recipe or something with us? Because today we are talking about nutrition. So do you have anything specialized, something, or to spice up the things? Anything you would share with us?
I think definitely one thing that I've learned through my nutrition like courses and just schooling as well is to change up what you're eating every day. So like although it's great to have like your staples that you're eating daily, you definitely want to switch it up, especially for like the different seasons. Because like in the winter when it's colder, you don't want to be eating colder foods. Like you want to have like the warming foods with you. So like adding like cinnamon and other spices that will warm up your foods. And then in the summer, you want to have cooling foods. So a lot more things that aren't as warm. So like that's when you can add more of like your probiotic, like yogurts and things like that. One thing that I do really like is having, I call them protein bowls. I feel like they're more like smoothie bowls. So like I'll put like a scoop of my protein powder, and then I'll add like lactose free because I'm lactose intolerant, yogurt with that, as well as like some berries. And I'll just like blend that up, and then I'll put it into like a bowl and add like granola with it as well. So adding some more protein that way, as well as my green source.
That sounds
And
interesting.
yeah, and add some berries with it. So that's really good. I do like that. And it's really filling as well. So that kind of like keeps you full longer. You can also add your omega-3 like oils in that as well.
I feel it must be looking colorful and the healthiest. So it would be really a nice to have that dish on my diet as well.
Yeah, it's really
Uh,
great.
One thing I wanted to ask is that because in naturopathy medicine there are researches day by day is increasing, and there are lots of researches coming out there. So how you keep yourself up with these researches?
Honestly, it's just reading research articles. And I'm personally not a big fan of reading. I'll usually get like the dictate speech to read it to me because I don't like to
Yeah,
read.
that's me as well, because even I find myself hard to reading. And stick to reading is hard for me, so that is why I'm getting tips from the peoples so that I could keep up with it.
Yeah, I definitely like the dictating speech. Like even though it's very robotic most of the time, like I still prefer that than having to read it myself. Sometimes just having it speak to me as well as looking at it, I find I digest that material a little bit better. But yeah, keeping up with research is definitely hard, and it's just something that you just have to keep doing, especially with ongoing protocols like the one I presented today, concussion. Like it's constantly getting reviewed and looked at, and there's a lot of different articles coming out. I know when I first started looking at concussion treatments, EPA was really good for concussion, they were saying. But then as further research got progressed, EPA really wasn't beneficial. They didn't like show any significant results, although the theory behind it was really great. The actual clinical result of it wasn't significant. There was no significant benefit with EPA, so that's why they're now like DHA is really great. So yeah, again, it's just going on to whatever site you use to find your research articles. Like I specifically kind of use PubMed a lot, or Cochrane as well to find my systemic reviews. I find those are really good, reliable sources to find my articles.
Yeah, that's even I would like to read your articles and researches, because in your bio we have just read it that you have just completed a really good research. So we would like you to in share in future that we could share your review articles and everything. So that's particularly great for us. One thing, this is the last question from my side. So, what do you, as per you, what are the skills, the tips or suggestions? I would prefer skill right now. So, what do you think the skills should be needed for the particularly successful naturopath?
I think one is just being able to talk with people like how we're doing right now. Just having that great communication. I think like just building those relationships with people and with any future patient is super important. I know personally myself, like I wouldn't want to go see a doctor who I wasn't on the same line with. Like I want to have my values and goals align with them. So just making sure that you're kind of open to different people's views of where their health wants to be, and trying to open yourself up instead of sticking within a box of like, okay, this is how we want to treat you, this is what we're going to do. Like kind of step outside of it and like meet the person halfway. One thing I always like to like go back to is remembering hearing a story about how one of my professors was treating a patient, and they were just drinking like Coke every day, like 3 times a day, every single meal. Like that's just what they drank. And obviously, like as doctors and naturopathic doctors specifically, we're like, okay, you gotta stop. Like you gotta switch that to water. And what ended up happening was the patient kind of was like, can I just decrease my Coke consumption to like once a day? And that's what they got to. And that was great. And I think we just need to like remind ourselves of, okay, like maybe we can't get them to be like optimal healthy, but we can meet them halfway and get them to like where they're still going to be happy, where they're still going to improve their symptoms, but it doesn't interfere with their daily life still. Like they can still do their life the way that they want.
That's actually a great tips you have given, so that I think each and everyone who are listening to us will help with this one, because most of our audience will be the future aspiring doctors. So these tips will help them as well. And once again, it was a really great presentation, and the way you described the topic, it was nice. So we would like you to hear you again in the future if we get a chance. And thank you so much for giving us your time and joining with us. Thank you so much, Michelle, for the perfect presentation, I can say.
Thank you. Yeah, it was a lot of fun.